My name is Dhanalakshmi. I am studying M.Sc Nursing first year. Today I am going to discuss about the community health nursing topic on healthcare delivery system at village level. Seminar topic on healthcare delivery system at village level. Where what are all the services provided at village level? Let us we will discuss. Coming to the introduction, India is a land of villages. About 80% of the population is scattered over 575,936 villages. 70% of which is not literate, and only about 20% of the rural population have healthcare facilities. The Rural Health Scheme is introduced in India in 1977 based on the principle of placing the health of the people in their hands itself, which was launched by the Rural Health Scheme program in 1977. It is three-tier system of healthcare delivery in rural areas, which was recommended by the Srivastava Committee in 1975. National health policy was approved by Parliament in 1983. At village level, what are all the services it will be provided means, let us we will see who are all the persons will be involved in this village health level. At village level, village health committee is responsible for providing health services to the composition of village health committee. Who are all the comprises of means, first one is the village health guide, next one is the trained birth attendant, and next one is the Anganwadi workers. These are all the three peoples will be involved in the deliberating the health services at village level. Who are all the means, village health guide, trained birth attendant, and Anganwadi workers. These are all the three persons will be allotted to deliberate the services at village level in healthcare delivery system. Coming to the village rural functions, to implement this policy at village level, the following scheme or in operation, there are village health guide scheme, training of local DAIs, integrated child development services, nothing but ICDS scheme, and next one is the accredited social health activists, nothing but ASHA. Okay, these are all the four persons will be providing the functions at village level. To implement this policy at village level, the following schemes are in operation. They are village health guide scheme, training of local DAIs, integrated child developmental health scheme, nothing but ICDS program, accredited social health activist scheme, nothing but ASHA. As all of you know about this. Role of village health guide activities. What are the activities they will perform at the village level means, participate in the rapid assessment, maintenance of village health registers, monthly health delivery report, every maternal or neonatal death, managing the village health fund, village health and nutritional day. That is nothing but celebration of nutritional day or a world health day. For all this, they need some economy or the funds to celebrate all those special days related to the health. Records of the ANM, the maintenance of the birth reports and death reports must be in the hands of the ANM. Nothing but tracking records, deliberating immunization or vaccination records, all the things they have to report monthly by monthly. They have to give the monthly reports. Now, what are all their functions? Let us we will see again once again. Participatory rapid assessment, maintenance of village health registers, nothing but registers and records and reports, monthly health delivery report, monthly they have to give the how many antenatals, how many postnatals, how many neonatals or infants are there. They have to give the tracking record to the higher officials or the authority. Every maternal or neonatal death, if any maternal death is there, postpartum death or whatever it is very important in the census, so that they have to give the report about the maternal or neonatal deaths. Managing the village health fund, village health and nutritional day. The health day must be celebrated by the village health guide. For all those, they need some funds. They will provide. Okay, records of the ANM. ANM must be records must be supervised by this supervisors. Next, what are all the roles and responsibilities of this committee? Sharing of the reports of village health committees, reports about health coverage facilities, record and analysis of neonatal and maternal deaths. It is very important. If any maternal death or neonatal death is there, means they have to give a higher officials report. Any epidemic occurring in the area or preventive action taken. For suppose corona is there in our epidemic Kurnool, they have to give how many cases are there daily, how many swabs were collecting, the throat swabs or the rapid blood test. For all those records and reports, they have to report to the higher officials to know the for what we will give all those reports means to take necessary action by the authority to prevent the epidemic or pandemic disease. Environmental sanitation at the village level, family welfare and nutrition campaign. Some of the campus they have to conduct like Anganwadi, Balwadi, then distribution of the albendazole tablets for worm infestation, for toddlers. Like this, they have to do some of the family welfare and nutrition campaign. Coming to the family welfare, here they will conduct the family planning operations in campaign manner. At a day they will select and they will encourage for the family planning operations. That is the family welfare and nutrition campaign. Monitoring of water sanitation services. Mainly the sanitation services must be included. Why? What is the reason means for this monitoring of water sanitation services? Through the water only, all the contaminated and communicable diseases will be happen. So the hydrochlorinating the water and monitoring of all these water sanitation activities can be supervised by the village health guide. So these are all the activities must be done by the village health guide, trained birth attendant, and who health activist, nothing but ASHA ICDS worker. Roles and once again I will read the what are all the roles and responsibilities of this committee. First one is the sharing of the reports of village health committees. Next, report keeping the update records and reports about the health coverage facilities. Record and analysis of neonatal and maternal deaths. Any epidemic occurring in this area and prevention action can be taken. Prevention action nothing but bleaching powder, hydrochlorinating, disinfection, health education about the hand washing techniques. So for example, we take corona, we will take all the preventive measures and we will give the health education to all the community people to prevent the corona spreading. Wearing the mask, sanitization, using the sanitizers, hand sanitizers, this and all. Environmental sanitation at the village level. Next, family welfare and nutrition campaign. As I told before that is the family planning operations, vasectomy and tubectomy. Next, monitoring of water sanitation services, which is important to prevent and control the communicable diseases like diarrhea, gastroenteritis, amoebiasis, etc., cholera, etc. Okay, these are all the functions will be done at the village level. Thank you for all of you.